Hello, my name is Tamara Hoffman, and I'm going to be presenting to you on the Teaching and Health Professions Education Artifact Analysis. So I just want to give you a little bit about myself. I am a UMKC Dental Hygiene graduate from the class of 2005. I joined the UMKC School of Dentistry Radiology Fellowship in 2008, and then in 2010 was put into a position as a clinical instructor in the radiology department. I have the pleasure of working with all 4 of our dental classes, as well as our dental hygiene classes and dental assistants who come over from the Penn Valley Community College. I just want to provide a little bit of a glimpse into my daily life in the clinical setting. I am in clinic full-time, 4 days a week. What happens is the students come into our radiology department, which is in the center of the entire dental pre-doc clinic. And as students require radiographs for their patients, they come into our department to get those x-rays. Once they're done taking the radiographs, they're going to come into a viewing room and they will bring up their patients' electronic health records and then their radiographs. And then what we do is we discuss the diagnostic quality and then go into differential diagnosis. So the first thing I ask them is, how did you do? What did you do wrong? And then what did you do to correct that? And then in most circumstances, if they need retakes, then we talk about what needs to be done to fix it, and then they will get help from staff in the back. So here's some snapshots of what our clinic looks like if you've never been in a dental school setting. The window over here, this picture shows our central sterilization department. The students all come to this area in order to get the instruments that they are going to require for whatever procedures they're doing. The dental students, each team, there's 109 of them, and they're divided into 3 different teams in the clinic floor. Each team has their own set of faculty, which are going to consist of some general dentalists, some prosthodontists who focus on like partials and dentures, doctors who specialize in fixed prosthodontic or fixed procedures like crowns and bridges. And then they're going to also have a periodontist faculty or hygienist in their department. Also got a picture here from our radiology department. This is a long corridor hallway right in the middle of our department with all these little rooms, and those are where the intraoral x-ray units are, so the students can bring their patients in there. We use ear, nose, and throat chair specialist chairs for the patients. And then I also included a picture from one of our panoramic radiograph rooms. So the artifact that I am going to be analyzing is basically a seminar review that I was asked to give at the end of one of the oral maxillofacial radiologist courses for the dental hygiene junior class. This was during their spring semester. So the topic that I had was proper panoramic positioning and panoramic errors. The theoretical lens used was cognitivism. We were linking the previously learned information and theories and creating more meaningful learning via insight, information processing, perceptions, and memory. And then through constructivism, bringing that knowledge that is formed within the learner by integrating learning activities and experiences into knowledge and beliefs. By this time in the second semester of the junior hygiene class, they've already had a little bit of experience down in the clinic, and they may have already been introduced to panoramic radiography. So they're able to, during this course that I'm giving, this seminar, they're able to draw from that experience and start bringing to life a lot of that information that they had read or been given before and connect it with what they've experienced down in the clinic and then share amongst their peers. The educational strategies used was primarily objective-based education. The radiologist had come up with objectives based off of their learning goals, and then assessments had been created to measure that knowledge that had been gained based off of activities that had been designed to reach those desired learning outcomes, which in this case was going to be taking a diagnostic panoramic radiograph. So the digital technologies that I used for this was primarily PowerPoint for the bulk of the seminar. Started off with my objectives that aligned with what the oral radiologist had for the entire course, as well as the emphasis that was needed on the technique and errors of panoramic radiography. And then I tried to include lots of slides with images from the clinic to help bring what they had previously learned in seminar and bring that more into life and relative to what they've already maybe seen and done in the clinic to help that information be more long-term stored. The digital technologies that I also used to help were Poll Everywhere was really great. I was able to produce slides with radiographs, ask the students on their mobile device to indicate where a certain type of disease was, maybe where the technique error was, in this case just pointing to an artifact that had been left and made an artifact on the image. And the traditional learning obviously was lecture based, and then we used some think, pair, share, just a couple little synopsis where the students were able to review some experiences that they had had in the clinic and compare to one another. The educational modality that we used was synchronous, face-to-face lecture. This was several years before COVID, so nobody at that time was really familiar with anything asynchronous, let alone synchronous online. But this worked really well. The learning assessment, obviously assessment is a means for measuring the effective retrieval of knowledge. And during this seminar, I wasn't doing any real official assessment, but what was happening was the learning that was assessed for the knowledge acquisition of the materials I was delivering was going to be assessed in the clinic during that time on days where they were going to be in clinic rotations. So when they're done in the clinic, they do have to do a radiographic interpretation skills assessment where they go through and they have to identify the diagnostic quality of their radiograph. Was it clinically acceptable? Was it unacceptable? And then indicate any pathological findings that they have, and then identify the technique errors. So through the time with me, we're kind of touching on those bottom runs of the Miller's pyramid, and we've reviewed what they know and then touched in on what they know how through some Kahoot activities that I did and some other pair share opportunities. And then by the time they come down to clinic, that's when they're going to start demonstrating their ability to show how and then do their clinical competencies to show their does. The alignment to my personal teaching philosophy was spot on, since it was my seminar. And I realized I have a very humanistic educational philosophy with an emphasis on the learner as a whole, getting to know them personally, knowing what their goals are, what might be stressing them, what their needs are, where they have some struggles, in order to emphasize the need and the importance for self-care, as well as subject matter. They're not going to be able to retain the information or recall that information if their head's not in it, if other things are going on and distracting. Being able to guide that student in the direction of learning through the engagement necessary for self-actualization and self-fulfillment. And then also creating that warm and safe environment for learning where we can share our mistakes and learn from one another and offer up opportunities that may help the other person from the mistakes that we've made and learned from. So some of my learnings going forward would be implementation of more engagement within these seminars, usually allotted only 50 minutes, so there's not a lot of room for too much adding, but also some more reflection, self-reflection for the students after we do these activities. And then again, using some of the more multimedia, some short videos on patient positioning, just to help bring that visualization and how very different positioning looks from one patient to the next, depending upon their anatomy. Kahoot and iClicker are some other great digital platforms to help engage the students. So the conclusions from this analysis was that the artifact met the needs by which the charge was, or the objectives were for this. I did learn a lot in how I would want to restructure a seminar like this moving forward, and just having a better understanding of how learners learn efficiently and how to not overload them with information.